Hello, Lindsay Meyer here. Now we're going to do some palpations of the elbow. We're going to do a few range of motions and a few strength tests. So first thing we're going to do is we're going to palpate the radial head. So first, in this position, the easiest thing to find is the medial epicondyle, right there. So we know olecranon process of the ulna is back here, right? And then right on the side of that big bony prominence, is the lateral epicondyle. Then from here, we're going to move just slightly distally. Okay, go right onto that radial head. Now, to make sure that I'm on the radial head, I'm going to actually have the patient move their hand in and out and make sure I can feel it pop into my fingers and out of my finger. One more time. Right there. Good. Any pain with that?
No.
Okay, good. Now relax. All right, so now we're going to move on to the ulnar collateral ligament. So I'm going to actually have the patient straighten their arm all the way out. This is on the medial aspect, right through here. Got the elbow crease, and then we're looking right here. So what I like to find first is the medial epicondyle, which I'm on right here, big bony prominence on the medial aspect. And then we're going to move from there, and we know that the ulnar collateral ligament attaches from here to the olecranon process and the coronoid process of the ulna. So right in there, yeah. And if I wanted to check it, I would just check the movement right here, that force, and yep, we got that nice force. Are you okay?
Yep.
Sorry, no, it's a little sensitive. Relax right here. Okay, so the next thing we're going to do is we're going to take a range of motion measurement of pronation. We're going to do that in a seated position. Okay, so first things first, you're going to bend your arm right here, okay? So this is supination, and this is pronation. So what I want you to do is I want you to move your hand forward as far as you can comfortably. You feel okay?
Yeah.
Any pain with that at all?
No.
And it feels pretty good, everything nice and steady. Okay, so to take this measurement, now that I kind of have an idea of what I'm looking for, I'm going to look. I want to make sure I'm not actually on the wrist bones and I'm not too far on the forearm to get into that musculature. So we're looking to kind of be right proximal to the wrist. There you go, right there. Okay, I'm going to actually change this up just a smidge. Okay. Okay, so here we are right here. That's your elbow right there. So I'm looking on to have my stationary arm right here to line up with the humor as much as I can. Perfect, thank you. All right. And any discomfort with that?
Nope.
About as far as you can go?
Yeah.
Okay, that's good right there. Perfect. Okay. We are looking at just about 80 degrees of forearm pronation. Okay. So we're going to take advantage of this position, and our next one is actually going to be a manual muscle test of supination. So same position, I'm going to remind you from here to here supination, so that's what we're going to be measuring. So I'm going to use the best body mechanics that I can to support the patient and myself. So I'm going to hold you right here, okay? And I'm going to have some force right here and right here. I'm going to hold you. So what I want you to do is right into me. You're going to try to go in this direction again, okay?
Okay.
And I know the patient has full range here. I know the patient does it without pain already. We've established that. So you're going to try to push into me, okay? Push.
Okay.
Try to go. Hold, 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 and rest. Good. So we have great strength there. We're a 5 out of 5. All right. Next, we are going to now lay down, and we're going to do a elbow extension range of motion measurement and then a flexion measurement as well. Okay. So you're going to have the patient lay down right here. Good. All right, so first thing is we're going to prop this patient's elbow up, slide over just a smidge. There you go. All right, going to prop him right here for comfort's sake now. And also, this allows for if we have any hyperextension, this allows me to catch that measurement as well. Okay, so what you're going to do is I'm going to have you at about, right there, good. 30 degrees of abduction is pretty comfortable. Straighten your elbow as much as you can. Oh, okay. All right, and this is where we have a little bit of hyperextension here. Okay. So my landmarks, my axis is going to be right over my lateral epicondyle. There we go. Good. All right. And you see nice lined up here. Yep, and we are looking at 5 degrees of hyperextension of the elbow. Okay, great. So now the last thing we're going to do is we're going to take a flexion strength measurement. We're going to do that using our handheld dynamometer. Here it is. And I'm going to focus on the biceps brachii. So if I'm looking to focus the strength on specifically that muscle, I really care about the palm placement, right? So if I'm looking for biceps brachii, palm needs to be up. Okay, so we're gonna keep the patient in this position. And I'm gonna move up so you can see me a little bit better. There we go. All right, so for comfort, I like to be above the patient here. And I'm actually gonna use my left hand for as distally as I can. You can see this, and I'm actually stabilizing with my right hand on the shoulder. So move your hand all the way up like you would make a bicep curl. Good. Any pain with that?
No.
Good. And we're looking for soft approximation because the bicep is getting in the way. So we have a soft tissue kind of muscle approximation here. We're not going to get all the way there. So we're going to push you in about right at 90 degrees. Okay, good. All right. So I'm going to pose you right here. Okay. Stabilize you. All right. You're going to gradually push against me.
Okay.
You're going to push as hard as you can. I'm going to lock myself out here. And I actually have my legs braced so that I don't move. Are you ready?
Yes.
Okay, go. Push, 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 and rest. Beautiful. All right. So that is how we would get a handheld dynamometer reading for elbow flexion, for specifically for the biceps brachii.